Today we'll talk about frozen shoulder. As the name says, frozen, it means stiffness of the shoulder joint which is associated with pain. It is also called as adhesive capsulitis, wherein the capsule or the covering around the shoulder gets tightened and thickened, thereby restricting the movement and associated pain. What exactly is the cause is not clear, but this is said that it gradually begins slowly and takes months or years to come back, and usually within 2 years of time it resolves itself. So I could say that it is a self-limiting disease. Symptoms: there are 3 stages of progress. First is the freezing stage, wherein the patient has immense pain, but the range of movement is preserved, but gradually it is coming down. Second is the frozen stage, wherein the pain is gradually less, patient is not having any pain, but he is not able to move the shoulder and the shoulder is frozen. Third is the thawing or the melting stage, wherein patient starts to develop increase in range of movement and starts to get relief of his symptoms. Each stage may usually last for months. I would say if one shoulder is involved, there is a chance that the other shoulder may also get involved, but it is less likely that the same shoulder will be involved again in the lifetime. Now, for some patient, it usually happens that it disturbs the sleep of the patient and it awakens the patient during the night time. What are other risk factors? There are certain risk factors for the disease. The first one is the age and the sex. It is usually common in females above 40 years of age. Second is the immobility. It usually occurs in problems wherein the shoulder is not able to move, or patient is not able to move his shoulder for a prolonged period of time. It may be prolonged bed rest, or it may be post-surgery of the fracture humerus, post-surgery for fracture shoulder, post-rotator cuff injuries, Parkinsonism, or any other problem where patient is confined to bed for a long time. The third one are the systemic diseases. There are few diseases wherein it is more common. The first most common is the diabetes mellitus. The diabetes mellitus patient has a high chance of developing frozen shoulder in his lifetime. Other diseases like thyroid problems, whether increase or decrease, Parkinsonism, CVA, or other shoulder related problems usually patient usually end up in getting frozen shoulder at one part of the life or other. Now the diagnosis is usually clinical, wherein there is restriction of movement with the internal rotation first restricted, then the external rotation, and then followed by abduction and later on the flexion extensions. So we need not get any investigations for that, but sometimes we do get x-rays or MRIs to find out any other cause of a problem. And for x-ray, because if at all patient requires a surgical correction or surgical manipulation, then the condition of the bone is important, because we don't want to end up in a fracture in case a patient has an osteoporotic or a weak bone. Treatment. Aim of the treatment is control of pain and preservation of the movement, the maximum what is possible, and to increase the maximum movement we can. There are 2 modalities of treatment for every disease: the pharmacological, the non-pharmacological. For this, I would say, for this disease per se, the non-pharmacological line of treatment is more important, because the main aim here is preservation of the range of movement and increase of the range of movement. This needs support of a good physiotherapist who would help you, guide you about your problem, who would tell you about the exercises, give you heat therapy, TENS, etc., which would help you increase your range of movement by decreasing the stiffness. But I would say that just going through with the classwork part will not going to suffice. So you need to do your homework well. It means after you come back of your exercise, you need to practice each and every exercise at your home and to the maximum, because the more you do, the better results you are going to gain. The second one is the pharmacological treatment. Pharmacological treatment here is just a supportive treatment which would help the pain to come down, which would help the inflammation to come down. The 2 pharmacological treatment are there. First is the medical treatment, wherein we have injections painkillers, anti-inflammatories for pain relief. Second is the surgical part, wherein there are 4 modalities. First one is the injection into the shoulder. We usually give a local steroid injection in the shoulder, which helps to decrease the inflammation of the capsule and helps in increase of the shoulder range of movement and decrease of pain. Second is distension of joint with saline. The third one is shoulder manipulation. Patient who is not being treated or who has severe problem and who is not getting relieved by medical management, in that case patient is admitted, general anesthesia is given, and shoulder is made to move in all directions possible and to remove all the adhesions which are there, so that the adhesions are broken and the range of movement is attained. But as I have already told, we need to get an X-ray prior to that to see what is the quality of the bone, because we don't want to end up in fracturing the bone. The fourth modality is the arthroscopic surgery, which is though rare, but it is also done wherein arthroscopically through a keyhole the adhesions are broken. Now the last one, the do's and don'ts. I would say the do: keep your joint moving if you are diabetic so as to prevent frozen shoulder. Second, follow the advice of your doctor in case of a post-operative period. If you have fracture of shoulder, fracture of arm, do follow the advice of the doctor. See your physiotherapist regularly. Third one, do exercises both the joints if you have symptoms in one, because you have a chance of developing it in the another shoulder also. Fourth, do your homework properly. I would say do your homework properly. Practice about the physiotherapy at your home along with at the physiotherapy center, because that is going to help you out. Now the don'ts. Don'ts is, I've seen many patients who hesitate to take medicines, who hesitate to take injections into the shoulder, but they have severe pain. So don't hesitate to take medicines, anti-inflammatories or injections into the shoulder joint. They are not going to harm you. They are for your betterment. They are for your health. So you can take medicines, take anti-inflammatories or get injections into the shoulder, because that is going to bring down inflammation, bring down pain, and along with that increase the mobility of the joint. Second, the last one, don't panic. Everything is going to come down. So I would say take care, be happy, stay fit. Please like my video and do share my videos to others. Also do subscribe to my YouTube channel, Dr. S Kohli, or my Facebook page, www.facebook.com/JS Kohli. I hope this video would have solved most of your queries, most of your problems. Still, if you have any doubt, do text me or WhatsApp me your name, your mobile number and your place of residence to my mobile number 730-710-7777. Again 730-710-7777, and send me your doubts, your queries, so that I can solve that thing and help you out to come out of this problem. Please do share the videos. Thank you very much. Stay fit, stay healthy. Stay tuned for further videos. Thank you.